Hello, my name is Dr. Ouillette. I'm a board-certified gynecologist here at Elite Women's Care. Today I'm going to answer common patient questions regarding pelvic organ prolapse.
What is pelvic organ prolapse?
Pelvic organ prolapse is the herniation of pelvic organs to or beyond the vaginal walls. Women can have prolapse of their bladder, rectum, uterus, vagina if they don't have a uterus, or all three. In everyday language, it is sometimes referred to as a dropped bladder or dropped uterus. Pelvic organ prolapse is a common condition that can be embarrassing for women to talk about, but shouldn't be.
What are the symptoms of pelvic organ prolapse?
The most common symptoms that bring women to the doctor is the feeling of a bulge coming out of the vagina. Some women may describe this as a sensation of pelvic pressure or heaviness. Other symptoms could be problems with urination or bowel movements. Patients may find themselves pushing the bulge back in place to be able to urinate or defecate. Some women have no symptoms, and prolapse usually is not painful.
How does pelvic organ prolapse happen?
Your prolapse likely develops slowly over time until it finally got to a point where you noticed it. Things that increase your risk of prolapse include pregnancy, especially if you had significant tears at delivery, advancing age, and menopause. Prolapse is the result of weakened connective tissue in the pelvic floor, which allows the pelvic organs to herniate.
What are the treatment options for pelvic organ prolapse?
Treatment options for pelvic organ prolapse include pessaries, pelvic floor physical therapy, or surgery. A pessary is a donut-shaped device that goes into the vagina and helps to hold the organs in place. Pelvic floor physical therapy is where you work with a physical therapist that specializes in the pelvic floor to help you strengthen the muscles of the pelvic floor. Surgery for pelvic organ prolapse is usually performed by a specialist called a urogynecologist. Some women choose not to treat their prolapse if it does not bother them, and that is an option too.
Will my prolapse get worse over time?
This is something we don't know the answer to. Some women discover their prolapse and choose to do nothing about it, and it never gets any worse. For other women, their prolapse does end up getting worse over time. There usually is no harm in leaving your prolapse alone and seeing what happens if you are not bothered by it, unless it is keeping you from being able to urinate. To learn more about the care we provide here at Elite Women's Care, please contact our office by phone or visit us online at elitewomenscare.com.